right, well, let's get started. Some people might still be filtering in, but let's get started. This is our Digital Scholar webinar that's hosted by the Southern California Clinical and Translational Science Institute, the SCCTSI, here at the University of Southern California and Children's Hospital LA. My name is Eric Peterson. I'm the co-director of Digital Recruitment and Scholarship here at the SCCTSI. I'm also an associate professor of psychiatry and behavioral sciences here at USC. So during our webinar today, if you do have questions, we ask that you please type them into the chat feature or into the Q&A. It's really up to you. You can use either one. I'm going to monitor the chat and the Q&A section, and we'll present the questions to the presenter at the end. But we're also fine to take questions here and there throughout. So if you have something burning and it's appropriate, we might be able to answer it during the session itself. So we are really, really excited today to have Dr. Lauren Henry here to present on ecological momentary assessment platforms. So we came across Dr. Henry's paper a couple of months ago, and just found that it was such a great tutorial to try to help figure out how to navigate the setting of all these EMA programs that are out there. So really enjoyed reading it and asked her to come and present, and she said okay. So we're really excited to have her come, and I know she's excited to present too. So let me just introduce Dr. Henry real quick, and then I'll push it over to her. So Dr. Henry is a postdoctoral fellow with the Neuroscience and Novel Therapeutics units in the Emotion and Development branch at NIMH, National Institute of Mental Health. She has a PhD in clinical science from Vanderbilt University, and her research focuses on leveraging technology, so things such as ecological momentary assessments, or EMAs, and digital phenotyping, to investigate neural and behavioral mechanisms of risk for psychopathology, and also to develop, evaluate, and implement neuroscience-informed preventive interventions for internalizing and externalizing psychopathology to help improve public health. So thank you so much, Dr. Henry, for being here, and I will turn it over to you.
Well, thank you so much for that introduction, Dr. Peterson. I'm so happy to speak with you all today as part of the Digital Scholars Program. And as Dr. Peterson mentioned, Dr. Peterson connected with us after seeing an abstract of our manuscript at JMIR. At that time, it was under review, and now, luckily, it was accepted and in press. And that manuscript has the same title as the presentation today: Selecting an Ecological Momentary Assessment Platform, a tutorial for researchers. And I'm so excited to be here and having been invited to speak, because our goal in writing the manuscript really was to help other researchers embarking on digital mental health research and interested in leveraging EMA in their work. And as part of the Neuroscience and Novel Therapeutics unit, we've been through a few iterations of EMA platforms in our group. So several times over, we've gone through the process of finding and vetting platforms. And at one point during COVID, we even went so far as to develop a novel platform for use in our own research. So we wanted to, even in just one very small way, to put our lessons learned to good use. And so we consolidated the knowledge we gathered in our most recent platform selection process, with the hope that it would help others going through the same challenges as our group, finding a platform that's suitable for our specific program of research. So today I'll provide a brief introduction to EMA. I'll tell you about our journey to find an EMA platform for our work. And then I'll share lessons learned throughout our journey and provide some recommendations about what we think are the best ways to find an EMA platform that's best suited for your particular lab, your team, and your research program. And we'll do some activities at the end and throughout to get you started thinking about how you might apply these recommendations to your own work. And I'm excited to learn from you all and learn together through our collective experiences in this space. And then at the end, I'll summarize briefly, leave some time for questions, and all of the details in this presentation can be found in the manuscript that was accepted to JMIR, including a list of EMA platforms and their websites, a list of questions that you can ask EMA platform developers, And I'll send that to Dr. Peterson, and maybe he can send it around after today's talk. So first, EMA is a tool for the collection of data in clinical research. And when I think about EMA, I like to think about three main components. The first is repeated. So surveys are administered multiple times over a period of time to measure a phenomena of interest. I think about real time. So participants report on phenomena of interest at the moment at which they occur, or close in time to the moment when they occur. And I think of naturalistic. So providing reports in participants' natural environments where those phenomena occur rather than in the lab or in the clinic. And on this slide, you can see a cell phone. So today, this is the primary means by which EMA is delivered. However, the way in which EMA is collected has evolved over time, with the first methods being paper and pencil. And then with the proliferation of technology, we have more commonly transitioned to EMA through tablets and smartphones. This new and more accessible means of EMA data collection has likely contributed to an increased use of EMA by researchers. And in the past 10 years, the use of EMA in published scientific research has increased by 168%. So if we can do a quick activity. So if you wouldn't mind, please put in the chat where you are in terms of integrating your EMA into your research. Have you previously or are you currently using EMA in your work? Do you intend to use EMA, but you haven't started yet? Or are you undecided? Okay, so you're here as part of the Digital Scholars Program, so you're well aware of the benefits of EMA. First, ecological validity. So we've learned so much about psychopathology from self-report questionnaires and lab-based methods, but they have limits. Questionnaires rely on retrospection, which can be prone to error, recall biases. Lab-based methods are high in internal validity, but might not approximate everyday life. And in contrast, EMA allows us to collect data with high levels of ecological validity, and it allows for generalization to natural individual experiences. We can also think about with in-person processes. So through EMA, we can examine changes across time relative to each individual. And EMA reveals temporal associations that are inaccessible with less granular methods. EMA also allows us to pair with other ambulatory methods. So EMA delivered from using a smartphone allows us to integrate other technology-based methods like accelerometry, GPS, social media use to better understand the experience of the whole person. We can also track dynamic phenomena using EMA. And especially those dynamic phenomena, they're otherwise difficult to track. So things like suicidal ideation. EMA also allows for a smooth transition from digital assessment to digital interventions, like ecological momentary interventions or just-in-time adaptive interventions. And then very importantly, EMAs might help us increase access to care. So 97% of Americans report owning a cell phone, and 85% report owning a smartphone. And there's little differences in those statistics across gender, race and ethnicity, socioeconomic status, and different aspects of psychological health. And so technology facilitated assessment and intervention can be more scalable than in-person solutions. So taken together, use of EMA has increased greatly in the past decade, and perhaps due to technological advances. And EMA is being increasingly delivered through smartphones. And delivering EMA through technology offers benefits that weren't otherwise possible through paper and pencil methods. So like, as I mentioned, increased accessibility, pairing with wearables, transition to digital intervention. But still, it creates at least a few challenges for us researchers. There are numerous companies who've responded to the call for developing and marketing EMA platforms, making it difficult as a researcher to be aware of, understand, and choose among the many options that are out there for us. There are also many different features and opportunities within each of these apps and platforms. And understanding those features and opportunities and deciding how they coalesce with our research programs is important, but it's time consuming. And then, of course, as researchers, we always have concerns and considerations around patient privacy and confidentiality, and technology just adds another level of complexity to that. So in light of all of those challenges, my group at the National Institutes of Mental Health, with individual labs led by Doctors Brotman, Pine, and Kurkansky, partnered with a lab at Boston Children's Hospital, and that's Dr. Kozowski's group. And together we decided that we would jointly select our next EMA platform. And in the time remaining, I'm going to take you through our journey to select an EMA platform and talk about the lessons that we learned along the way. But first, just a little bit about our groups for some context. So at NIMH, we focus on identifying treatment targets for psychiatric disorders, anxiety, depression, irritability, and developing innovative, scalable, and cost-effective interventions for kids and adolescents between 8 and 17 years old. And we have experience as users of multiple text-based and app-based EMA platforms, and as developers of an app-based platform for our use in our own research studies. And at Boston Children's Hospital, their group focuses on youth that has a slightly larger age range, so 7 to 14-year-olds, with chronic and acute pain and substance use disorders. And Dr. Kozowski's group leverages EMA, wearables, and the internet to assess constructs of interest, behavioral patterns, motor activity, cognitive functioning, and then also develop and provide smartphone-based interventions to their population of interest. So working together, we worked through a 5-step process to select an EMA platform. And today I'm going to take you through each of the steps that we took. So first, both our teams at NIMH and Boston Children's Hospital came up with a list of individualized and prioritized needs for an EMA platform. Then we created a list of platforms. We conducted a web-based review to determine the capabilities of each platform. And then we selected 7 platforms that seemed to me be comprehensive overall in terms of the features that they had for EMA, and then that we thought were well suited to the needs of both of our groups. For our third step, we determined our individual institutional security, privacy, data management requirements. At NIMH, that meant meeting with our data security officer, and at Boston Children's, that meant corresponding with their IRB. Then we actually met virtually with the developers of each of our final 7 candidate platforms. And we did that in order to confirm our understanding of the platform features that we learned about through our web-based search, ask about features of interest that weren't explicitly described in the developer websites, and then answer our respective institutional security, privacy, and data management questions. And then finally, for 1 week, we evaluated each of the 7 candidate platforms with members of our labs using a combined subset of items that we had either previously used in our EMA research or were planning to use in the next iteration of our work, our next studies. And then both groups compared each of the platforms, each of the 7 platforms, to our individualized needs, and we picked best fitting platforms for our groups. And we had originally thought that we'd select the same platform to work through both of our groups at NIMH and Boston Children's, but in the end, we ended up selecting different platforms. And that was because we each had different teams and different research programs, and we needed platforms that catered to our groups and our teams' needs specifically. That was a surprise to us, and probably one of the most important things that we learned in the process. There's no one best EMA platform. The best platform is the one that's best suited to your needs. So the first step of our process was each group coming up with this list of individualized and prioritized needs for an EMA platform. And I'm going to walk you through our list as an example for you. And I'm going to highlight what we had in common and where we differed and why. So first, in terms of shared needs, for both teams, our top priority was compliance with institutional data security requirements. We knew that if we couldn't get our platform approved by our institutions, we wouldn't be able to start our EMA research. So that was top for us. Second, we both highly valued child and adolescent friendly platform interfaces. So for us at NIMH, a simple, single, engaging app would be one that would be used and would reduce our likelihood of missing data. So that was really important for us. And at NIMH, we work with a slightly tighter age range. So we wanted a simple, brightly colored display and gamified incentives. And then Boston Children's was just slightly different. And then they work with emerging adults as well. So they wanted to be able to customize their display more depending on the age of their study sample. Both of our teams valued researcher dashboards that would facilitate tracking individual level and sample level EMA survey compliance. At NIMH, we have an ongoing treatment study. And so additionally, we required a dashboard for clinician use that would allow for visualization of our symptom data and critical clinical items. And then both of our teams were interested in wearable integration, but we prioritized this differently. At NIMH, we didn't have any ongoing studies that required integration of wearables with EMA, so that was lower on our list. But then at Boston Children's, activity and sleep data are collected in the majority of their studies that are ongoing. So that was highly valued for them. And then there were some needs that were specific. So for NIMH, we have a postdoc who recently moved to Israel, Rayut Naim. She's fabulous. And we're going to continue to collaborate with her in her new lab that she's forming. So for us, compatibility with Hebrew was important. Previously, we experienced lags in getting updates to our surveys implemented in the platform in a timely manner. So we wanted to make sure that our new platform was self-programmable fully. Then we had planned some item types that were either currently being used for our studies or we wanted to be using in the next iteration of our studies. And so we wanted to make sure that those options were available on the next platform. Specifically for us, that was a thermometer display that would allow kids to rate their mood on a thermometer, and then a visual analog scale with a midpoint response. And then in the future, we're interested in engaging in research that allows for passive sensing like GPS and dyadic interventions or interactions like a child survey triggering a parent survey, for example. So we want, while they weren't immediate, so they weren't highly ranked, we knew we wanted to do them in the future. So it was something we were thinking about as we were looking at different platforms. And then thinking about Boston Children's Hospital, they had some specific needs as well. So for them, EMA adherence or compliance was a challenge in their previous work. So they prioritized platforms that offered direct messaging capabilities within the app so that they could send participants survey reminders, they could troubleshoot issues with wearable devices, and they could inquire about compliance with their participants. Pricing was also a consideration for them. And they needed to compare platform packages and pricing relative to their needs and corresponding platform features. And then they prioritized interactions with developers, including response time and response quality, given multiple issues that they had previously with both researcher and platform interfaces in their previous EMA platform. And this factor definitely contributed to our decision-making at NIMH as well. We just didn't explicitly think about it and prioritize it at the beginning of this process. I'll talk more about that a little bit later. Okay, so for our next step, we wanted to understand what EMA platforms were even available for us to choose from. So in practice, when we went through this journey, we started with a smaller list, about 15 platforms, and we created that list based on our previous experiences, the previous experiences of our teams, knowledge from collaborators, and then also a web-based search. But for the purposes of the paper and this presentation, we did a more comprehensive search, and we found 49 platforms that were app-based, 11 platforms that were text or web-based, and then 3 platforms that allow you to design your own platform. And that's quite a lot to investigate and to choose from. And interestingly, we still found 12 platforms that researchers had developed for their own use. And one of them, Rate It, was created by our own group at NIMH. And I think this speaks to the fact that finding an EMA platform to suit your needs is complex and overwhelming. And it's hard to know what you don't know in terms of all the platforms available and what they have to offer. So our next step. So after understanding the landscape of platforms, conducting a web-based search to understand not only what's out there, but what features they have to offer, at NIMH, we met with our data security officer, and Boston Children's Hospital corresponded with their IRB, and we determined our individual institutional requirements for data security. Now, I would recommend meeting with your own relevant data security team or IRB, whatever is relevant for you, early, before you're getting too far into this platform selection process. Because for us, it actually totally eliminated some platforms that we were considering. And in the paper, we include a full list of questions asked by our individual institutions in our supplementary material. So that can be helpful as you start to look at platforms and think about what your institution might require or ask of you. But here are some of the themes. So the first is data location. Think about where the data will be stored. When the data is transmitted from your device or the participant's device, what are all of the locations that will be stored during that process, even temporarily? Will the data be stored in the country where you're conducting your research? For us, that was the United States. Will the data be on the device for any period of time? How will the data be encrypted? And for PHI and non-PHI, what are the differences in terms of how and where it will be stored during all points of data collection, analysis, and then long-term storage? We were also asked to think about access to the data. Does anyone outside of our institution have access to the data, including the developers? We had to think about data retention. So what will happen to the data when the study is completed? We had to think about onboarding. So how is the app downloaded to the participant's device? Through the App Store? Is it something that the participants do themselves, or does the lab member do that? We were asked to think about app security. So how will the app be secured on the device? A password, a PIN, nothing? How will access to the app be limited and to whom? Does the app allow for two-factor authentication? And does the app allow for total wiping of all data or all information? And then we also had to think about the functionality of the app. So will the app be able to access other apps on the device in order to function? So things like location, your contacts, notifications, microphone, camera. And this is particularly important for apps or platforms that have passive sensing integration, because those platforms that do will require access to a lot of the other functionality and a lot of the other apps as part of the participant's phone. Okay, so the next step would be to meet with the developers of the platforms that you're considering, your candidate platforms. This is a really important time to ask any questions about features or needs from your lab that were not answered during your initial web-based search. And then also just to confirm what you did learn from your research on the app's websites. Things might change, right? Ask those questions that you were asked from your IRB or data security, ask them to the platforms, make sure that they can answer them, and then you'll take that information back to your IRB or data security team to see if those answers are sufficient. And then ask if you can pilot test their app. All of the 7 platforms that we were considering agreed to let us pilot test the app without any issue. And then for each of our final 7 platforms that we were considering, what we did was we used a mix of our survey items and Boston Children's survey items, and we tested those surveys with members of our individual labs. And then we asked for their feedback on each platform. Now, when you meet with developers, there are many different areas that will be important to discuss. And again, it depends on the needs of your lab and your priorities. Some areas we haven't talked about before that I'd like to highlight. First is compatibility. So think about whether you will give study phones to the participants, something that you've purchased from your lab and you're going to loan out to your participants, or whether participants will use their own phones. If you've already purchased study phones, and let's say they're Androids, for example, make sure that the platform runs well on those phones. And that's where actually testing the platform comes in handy. And if you have participants use their own phones, you'll want to make sure that the platform is compatible with a range of different devices. Another thing to think about is onboarding. So how do you intend to onboard your participants into the study? In thinking about this, I think it's important to consider how tech savvy both your team is and your participant population. Make sure that the platform allows for the type of onboarding that you envision as being best for your group, your team, your participants. So that might be having them come into the lab and onboarding in person, or it could be onboarding virtually. And then in terms of means of onboarding, it could be an email, a text, a QR code. What's offered by the platforms differs by platform. So make sure that it's consistent. And then cost is really important to consider. Of course, you'll have a budget kind of in your head, perhaps ahead of time. And we found a wide range of quotes for our study across the platforms that we tested that actually range from $4,000 to $60,000 for 1 year. So think about also hidden costs like setup fees and consultation costs. So if you're having problems, you're having technical difficulties, are consultations with the developers baked into the price, or is it over and above that you'll have to pay for in order to correspond with them about these issues? Also think about whether any additional features that you might not need for your study in your lab are part of the platform that could be driving up the subscription cost. So for example, an app that's optimized for integration with passive sensing might be more expensive. And if you're not going to be implementing passive sensing as part of your overall study protocol to integrate with EMA, you don't necessarily want those costs that the developer incurred in integrating that into their platform to have to trickle down to you. You might just consider picking a platform that's a little bit more simple and better suited to your needs of perhaps just doing EMA rather than passive sensing as well. Okay, so now that you've talked to developers, you've verified that you can do a pilot test the apps, test it yourself, and think about both the user experience for your researchers, the research group, the people that will be managing data collection, and then also the participants. And then have your lab members test the platforms and get their feedback. And then after that, once you've done that, it's time to take stock of your options. So you'll see on the screen just a quick and dirty tool that our team at NIMH created to visually compare our 7 candidate platforms. And the way that we coded this was really simple. So a smiley face in green, it had everything that we needed to the fullest extent that we were hoping in terms of that specific need that you'll see in the column on the left. A straight face in yellow had what we needed in some form or capacity, but it wasn't ideal. Or the platform told us that they would be integrating that feature into the platform relatively soon. And then a sad face in red represents that the platform did not have that feature that we needed and would most likely not be integrating it into the platform, even if it was expected in the future in the time frame that would be necessary for our work. So Dr. Peterson, is the chat functional yet?
It is, yes, you should be able to see it.
Oh, great. Okay, so I'm curious for the group, what platform do you think that we chose based on our little tool here? You can just put 1, 2, 3, 4, 5, 6, 7 in the chat. Did we get any responses? Oh, actually,
yes, I'm sorry. It looks like 5, 1, 1, 1.
Okay, fantastic. Yeah, so you're pretty much right on point. So we selected number 5. And then Boston Children's selected number 1. Of course, this tool isn't optimized for their group, but I just wanted to kind of call out which one that they did select. And the platform that we chose did meet all of our top needs. So again, platform number 5, but it didn't meet all of our needs, particularly wearable integration, which I think speaks to why it's important to prioritize those needs. And then a few things that I think were interesting and important about our final selection. At NIMH, our selected platform didn't initially meet the security requirements due to data storage outside of the United States, actually. But the developers proposed a viable technological solution for an additional cost. And this goes back to my comment earlier about the importance of your relationship with the EMA platform developer. You can glean some information at the piloting stage when you're testing the platform about what the relationship might look like later. So even though we didn't initially prioritize developer interactions at NIMH in particular, we quickly learned how important it was for us to have a platform that was responsive, or to have a developer that was responsive to our needs and quick and comprehensive in their correspondence with us. And you'll see some question marks on the tool on your screen as well. So developers from one platform didn't respond to our email inquiries about some of the features, and that definitely factored into our decision-making there as well. So as some of you called out platform number 5 as, or platform number 1 as one that we might have chosen. So that was actually our second choice platform, and it was selected by Boston Children's Hospital. And I think that it could have met our needs reasonably well. So for me, that shows that there's not one best EMA platform, but multiple solutions could potentially be a good fit. All right, so I'm going to ask if we can do a quick activity to consolidate the learning from today. So I'd like you to think through a little bit, either whether you're currently in a lab or leading a lab, or you're in training and you plan to lead a lab in the future. Think about what your prioritized needs would be. And once you have thought about that for a little while, you can put your list in the chat. And then we can kind of think through your kind of answers. I don't know if can people come off mute in this presentation?
I don't think they can.
Yes,
That's
actually,
okay.
I can enable them to talk. So if they want to raise their hand or whatever, I can enable them to chat or talk.
Awesome. Thanks, Karen. So if you feel comfortable, you can, Karen will enable you to come off mute, but otherwise you can just put some of those platform prioritized lists in the chat.
Yeah, one of the ones for sure is, related to cost, especially, for trainees and students and, young investigators or early stage investigators. Because, I mean, you mentioned such a huge range of the costs too. It just seems like so many of our decisions really come from what are we going to be able to do with, this small piece of money. And, does it make sense to just develop something kind of not so great ourselves that's cheap, or
Yeah.
can we get one of these platforms that's out there that really works well but might cost more?
Yeah, it's so true. And there's such a variety, I think, about how different platforms structure their pricing. So there's a lot of variables. So some of them have their cost structure based on how many participants you plan to enroll in a given year, how many people in your group are using the platforms, how many different types of studies that you have within a platform. So sometimes if you have sort of like a larger group that you're going into a platform with, that can reduce some costs. Sometimes platforms provide discounts for trainees. So those are things to think about. Or if you kind of buy out for 5 years rather than a year, you can have a discount there as well. So it's definitely worth talking to developers about different options and letting them kind of know your budgetary constraints. So Matt put in the chat price. Yep. So right on point there. Ease of use and reliability are big ones. Yeah, exactly. And ease of use, I think sort of we found too, ease of use for both the researchers on our end and ease of use for the participants as well. We want them, of course, to be able to for the platform to be something that with a good user experience so that we can increase the possibility for compliance. But then also on the side of our team, again, depending on your level of technological savvy in your group, you want it to be easy and functional and easy to onboard new people in using as well as part of your group. Yeah, so thanks for that, Matt. I also see Adam, ease of use for researchers and study participants, exactly. Flexibility in building questions and responses, bi-directional communication. Yeah, so maybe that messaging feature that Boston Children's Hospital was prioritizing is something that you're getting at there, and data security, of course. Yeah, and then flexibility in building questions and responses. So platforms really do vary in the different types of ways that you can present items. So some platforms, it's kind of just text. Other platforms, you can actually show videos or you can show photos and have people respond to that. And then the different item responses vary as well. Choose one, choose many, actually showing what's going on in your environment by uploading a video or uploading a picture. So it's really important to think about what type of surveys that you are going to implement in your study and your future studies to determine whether the platform can meet those needs in terms of what you need for your items. Yeah, great. Thank you so much for sharing. So some key takeaways. So think about what you need from a platform and make sure that you prioritize your needs. You may not find a platform that does everything that you need it to do perfectly, right? Like wearables integration isn't something that we were able to do with our current platform, but you can likely find something that does most things pretty well. Understanding your institution's policies around data security and management are very important. And I think it's important to do this early because it could eliminate some platforms that you spend time developing relationship with the developers and time understanding and piloting. So eliminating that added time devoting to a platform that you won't end up being able to use, I think is important. We learned it's very important to pilot platforms before you use them. A lot of platforms that we thought that would be contenders, once we actually use them, we decided that they weren't going to meet our needs. And then the process does take some time and work. So start early if at all possible And it can be helpful to collaborate with other groups to share the burden of finding suitable platforms and testing them, even if you don't arrive at the same choice for your ultimate platform in the end. And then the best platform really is the one that best fits your prioritized needs. So if you want to put in the chat something that you learned during our time together that you might implement in your own EMA platform selection journey, or something that we might have not covered that you've implemented in the past that was helpful that you'd like to share with the group. And then I saw Colleen asked a question while everyone's thinking about that. So Colleen said, have you ever explored doing EMA through REDCap? So I actually did my graduate work at Vanderbilt, and Vanderbilt was one of the developers of REDCap. And I thought about it when I did my graduate work and ended up not proceeding with it because I wanted to, at that point, at least, it wasn't as advanced as it might be now. And then we haven't really, it wasn't one of our top 7 sort of contenders during this iteration at NIMH. So I don't have a ton of information about it, what it looks like to do EMA through REDCap, but it was one of the platforms or one of the options that came up on our list, I think. So I think it would be worth exploring a little bit more. Yeah, but I don't know too much about EMA through REDCap. We didn't test it. Thanks for that question, Colleen. Oh, and then I see Colleen previously in the chat said, we use a platform, but the notification and assignments are not consistent and seem to depend on the participant's phone type and storage. I think you explained this as an issue. Yeah, I think that for us, so we had some clinicians in our group that had Androids. So we definitely tested on different phone types, and some of the candidate platforms that we tested just didn't work well on those devices. And in our group, we have a mixture of ways that we get our EMA to participants, such that we do have some study phones, but then if participants have their own phones that they want to use, we let them use those. So it was really important for us to have a platform that worked on a bunch of different types of phones, but we also kind of had that backup plan that if it wasn't working on their phone, we could give them one of the our study phones, and that kind of works well for us. But again, I think that yeah, you can definitely run into kind of those issues, and that's kind of where the piloting comes in handy early on, so that you don't invest in a platform that then you're going to run into a lot of technological difficulties down the line with, and you have to kind of come up with contingency plans if it doesn't work with certain phones. Yeah, thanks for sharing that, Colleen. Okay, well, thank you all so much for having me here today. It really was a pleasure. This was the goal for our manuscript, to kind of share our lessons learned with you all. And I'd be very happy to take any questions, any additional questions you might have.
Awesome. Thank you so much, Dr. Henry. This was really great. We really appreciate this and would love to see, well, we'll all search for the paper after this, once it's published in JMIR. Did they put up the preprint there, or do you know when it will be released?
They didn't yet. It's in copy editing right now, so I'm hoping within the next week or so I'll send it to you after it's up.
Gotcha. Great.
Yeah.
So I'll yeah, if you don't mind, I'll just ask a question, and then we'll see, give people just a chance to put in a few questions into the chat if there's any. I don't see any in the Q&A, so yeah, just throw them in the chat. It'd be easier for us to monitor there. Yeah, you know, I really liked how you started with, you know, the importance of, and one of the attendees mentioned this too, just the importance of data security, because
yeah,
you know, it's just so essential, and that's just stuff that like a lot of us researchers don't, I mean, you know, it's very important to us, but just don't understand kind of the back end stuff that's happening in all these apps. So I know that when you know, when I work with a group, they'll send me this, you know, sheet or something that I then submit to the IRB, you know, and it passes their sniff test. But you know, it's just such an important piece to consider, and I recognize that, like, if you're trying to develop your own or work with somebody who's a little less established, you know, you might lose that piece, and it's just a deal breaker right from the start. So yeah, I like that. That was really kind of one of the first things that you guys really attended to.
Yeah. And to that point too, I think, we want to maintain participants' security. We want to make sure that we're doing everything in accordance with our institutional requirements. But I think another piece is making sure that participants feel comfortable with their participation in the research. And for some platforms, especially the ones that had passive sensing enabled, um, our lab members and our clinicians that we piloted those platforms with, they raised a lot of issues about what kind of data would be collected for them. So for those platforms, often they have sort of like the little pop-up that comes up and say, can we enable access to your microphone or enable access to this, that, and the other thing? And they raised issues with that. So, of course, like this sort of passive sensing research is really important, and we can learn a lot from it. And there's these considerations in terms of data security and making sure that participants feel as though their data is secure. So I think managing that kind of moving forward is important, in addition to making sure that we're doing everything that we need to make sure that their information is secure, helping them feel that as well.
Great, thanks. Yeah, there's a couple questions up in the chat now. I think you can see them, right?
Okay, great. Okay, so I see Matt says, it seems hard to estimate the cost given the different platforms structure their fees differently. Yep. But what are the typical cost ranges you saw for the EMA platforms? Yeah, so it is really hard to estimate the cost. And what we found to be sort of first most effective was thinking about the next study that we were doing that we're going to implement EMA with, and then thinking about how many participants we were going to have, what types of surveys we were going to be using, how many people were going to be accessing the forums, and then consistently across our 7 platforms, giving them those specifications and asking them what the fees would be for like the first year and then the first 5 years for those specifications. And that helped us compare across pretty well. And then the ranges were really wide, between $4,000, $3,000 to $4,000, and $60,000. It surprised us. It really did. And a lot of that was some like the startup costs. And then if you project it out to 5 years, it became more reasonable for certain platforms. But yeah, it really, really varied. It did. Jamie says, did you consider or review any open source platforms like SEMA3? Yeah. Also, thanks for the chat. Yeah, thank you, Jamie. We did. So that is one of the platforms that is part of our list of the 63 platforms that we found. And you'll find that in the paper. We don't specifically go into any of the specific features that any of the platforms, other than ability for connection with passive sensing and EMI or just in time adaptive intervention in the paper, because as NIMH, we don't want to endorse any one platform or over the other, which is why you heard that I didn't name the platforms that we finally went with. But yeah, that is one of the ones that we evaluated, that we considered. And you'll find that in the paper, along with a few different features of that app, and then the rest of the apps that we considered. Yeah.
Great. Thank you so much. Okay, so I think if there's no further questions, then we can wrap up. As everyone knows, this will be available on our website in probably just a couple of weeks. So if you want to rewatch it, share it with colleagues. I know a bunch of people that have already told me they were going to rewatch this. It's just the time didn't work for them. So we're excited that we're able to put that up on our site. There's also a link to a survey if you could fill out. This is helpful because we can give Dr. Henry some feedback. Karen put this in the chat. And also just helpful for us. I mean, if there's any topics that people are interested in seeing, please let us know. People surprisingly say yes to us when we when we ask them to come. So we really appreciate it. People like Dr. Henry coming and talking to us. So yeah, I mean, we love talks like this, these kind of how-to, and just, starting from going from a place where it's completely overwhelming with 48 plus different platforms to try to whittle it down, and just best practices and lessons learned from people that have been out there in the field. So Greatly appreciate you, Dr. Henry, for coming today, and we will see you all in after the holidays. I guess we'll see you again in January.
Thank you.